It's a talk of improving cancer survival in Denmark, and it's all about getting organized as a country and centralization and doing a lot of different things. And it actually has taken about 20 years to get to where we are today. It's across the whole country, it's national, and it's across all cancer types, not only gynae-oncology, but of course I'm talking about gynae-oncology today. First of all, we had a process coming from bad prognosis and looking into this and trying to find out what was wrong, and there were different things. The first one is centralization lacked. We had operations, big operations going on in nearly every hospital in the whole country, and it had to be centralized. And we could show with the numbers, survival numbers, that it was necessary to do something. And the National Board of Health went into it, and gradually we could get the number of departments doing, especially ovarian cancer, down from 52 to 4. So now today it's 4 centers in all of the country, and everybody gets referred. And then there was another thing is organizing in having guidelines for everything, and guidelines that actually people are, doing what it says, getting better at surgery, and we also have, as one of the, we have actually had 4 cancer plans within the last, I think 15 years. And each plan has had a focus on different things. The first one was a lot about staff and equipment and so on, getting up to a good height. And the next one was on surgery and education of surgeons and so on. And in the third plan, we also had a big focus on the flow of the patient, because we had a lot of waiting on examination and then waiting on OR. So we had to narrow it down, and we have something called packages that was introduced in 2007, and we're still doing it. And then you have to make the whole thing from the patient is referred to treatment is actually performed. For ovarian cancer, if it's surgery, 24 days, and chemotherapy, 31 days. Just one example, but every disease has its own package, and this also had some impact. And then you can say, what was the effect of all this? And we have actually, for ovarian cancer, made an 8% improvement in survival, and it's a small number, but actually it's a huge number, especially considering that it's been a flat line like this for decades. So some effort has come out of it. Some results have come out of it. I can't give you the figures, but I know that it has had a great impact on lung cancer, which is a disease that's really difficult, and a lot of people die early. And it's had an effect there too, that I know of. I know that centralization had an effect on pancreatic cancer, which has also a bad prognosis, but also has been very centralized. That's the 2 ones that I can just think of right now. No. This is all on government. The government has also provided extra money during these plans, because for every plan there would be a budget. And I mean, for instance, equipment was lacking, and there was a budget for this equipment for radiation and scans and so on. So there was a budget, but it's all within the government.